I'll be testing the proximal radius. I'm going to have her flex her arm, and I'm testing for springiness or rub. It is springy, and then it's a rub on supination. Okay, so I'm going to do a radial adjustment. So she was springy on pronation. So then I'm going to do a contact lateral to, I'm going to cross fibers. And then it's going to be L2M and P to A. Doing the proximal ulna. First I'll be palpating for tenderness on the ulna. So it's tender. Then I'm going to contact the olecranon, and then my line I drive is going to be P to A with a straight arm, extended arm, and P to A. Herring's muscle test. I'm going to have her flex on my leg with a straight arm. And then, so I will be doing a Herring's muscle test for the ulna. I'm going to have her place her elbow on my thigh. I'm going to have her arm extended. I'm going to press down. So that's a grade 5. So we can continue to the next one. Now it's going to be flex. I'm going to press down. That's a grade 4. So now we're going to see if it's a medial or lateral. First is medial. Okay, so that's a grade 5. That's a posterior medial. Now we're going to go over to the lateral side. Resist. That's a posterior lateral. Grade 5. Okay, so I'm going to be adjusting a posterior medial ulna. Her olecranon. And then my line of drive is medial to lateral and posterior to anterior. And then now I'm going to be doing a posterior lateral ulna. My line of drive is going to be lateral to medial and P to A. Did I say that right? Okay, so I'm going to have my patient, I will be testing for the Huron radius muscle test. So I'm going to have my patient resist. Okay, resist, that's a grade 4. Then I am going to do the 35 degree and have my patient thumb towards her shoulder while I pull, and I want you to resist. Resist. Okay, that's a grade 4. Okay, then I'm going to do a radial lateral adjustment. Stop. So I'm going to do a Huron protocol radius muscle test. I'm going to have my patient resist, that's a grade 4. Then I'm going to have my patient do 35 degree and thumb towards her, and resist. That's a grade 4. Then I'm going to do a posterior lateral radius adjustment. So then I'm going to come over here, find the radial head and then the radial neck, and then I'm going to slide anterior to medial, move it swing, and then I'm going to do an posterior anterior radial adjustment. I'm going to locate the radial head and then go P to L.